Hi, my name is Nathan Paxton, and I'm your instructor for this course in the SIS Master's Program. My PhD is in political science, and so I study the problems of global health from the perspective of a political scientist, that of a social scientist. I've been looking at these problems for a number of years now. I wrote my dissertation on essentially how is it that countries make a choice between pursuing policy A and policy B when they're choosing their HIV policies, and what are the organizational factors around that go into why they make those choices, and how do the structures of their governments change the choices that they make. I've also done research on how internal conflict, like ethnic warfare and civil warfare, affects the overall prevalence of HIV within a country, and how that might relate to the effect that democracy has on all of that. And I started doing some research recently on the historical roots of the smallpox eradication program to see why it is that some countries change their minds about whether to support the smallpox program or not, based upon the political expediency or not of the day. I tend to look at these issues as a political scientist would, rather than as someone from a biomedical field or a public health field. In political science, we tend to say that there are three types of explanation for why social actors do the things they do. We say that they have interests. We say that there are interests, positive or negative, toward taking some action. We say that there are institutions that constrain or shape or incentivize certain behavior. Or we say that there are ideas that are powerful and that give people alternative ways of looking at the world that they then try to shape the content and the force of their social world in those directions. And so on some level, as we're going through the course, you'll probably be able to detect that I'm looking at the problems of global health through the perspective of interests or ideas or institutions. Now, as we go through each session, I will always start out with a set of what I call the questions of the week, which indicate, in essence, what I think are the most important ideas and knowledge in that week, and finding a way to integrate them together. So they're less going to be fact-based, and they're really going to focus on ideas from the readings, ideas presented in our asynchronous material, and ask you to bring them together to give a coherent, reasoned, but well-supported argumentative answer. I've made the course in such a way that I hope it will be challenging and at the same time rewarding. By the time you finish this course, you're going to know more about a topic and an approach than you did before, but you're also going to know about a topic and approach that you can get in very few other places, because the sort of social scientific analysis of global health politics that I do and that a few of my colleagues do isn't done very many other places. So this is a rare opportunity to see how political scientists and social scientists like me look at a very specific class of problems that people like me don't often study. I'm looking forward to the course, and I hope you're looking forward to it also.